Hello everyone, this is Leslie Cornwell, Certified Nurse Midwife with Midwifery Business Consultation. This next section of the Billing and Coding course for midwives has to do with billing terminology. It is a really important topic. Just like when you learn Spanish, you learn French, you learn another language, you have to be able to understand the definitions, what these words mean, be able to comfortably explain to other people what are all these billing codes and terms that we're talking about. There are billing encoders that go to school for years, and my purpose is explaining to midwives the basics that have to do with running a successful midwifery practice, the business aspect. If you're going to be doing any insurance reimbursement, whether you have a third-party biller, you still need to understand, because patients are going to have questions. You're going to want to make sure you're getting paid appropriately, and you want to give accurate estimation of costs to families based on their insurance plans. So takes time learning another language, read books, take the time, make yourself flashcards, and just over and over again think about these things. And it's not just your midwifery practice. We are all patients ourselves and have to understand this to advocate for ourselves. You're going to have surgery, you're going to be hospitalized, you're going to have medical bills. You're going to want to make sure you are paying your appropriate part, that the charges, the codes, the allowed amount is all accurate. So the big thing I stress with your midwifery practice is you want to increase your reimbursement, you want to have high patient satisfaction, and you want to get paid what your value is for those services being rendered. So we need to be able to translate to patients, to translate with our billing services, and have conversations with insurance representatives of what is the verification of benefits, processing the claims, what the assignment of benefits looks like, what the explanation of benefits looks like. You want to be able to understand all these codes, these ICD-10 codes, CPT codes, place of service codes. It takes time to learn all these things, but our goal with this course is you have life access, you repeatedly watch these sections, and you can learn step by step all the different aspects of billing and coding for your practice. So these are other reasons why it's really important. Decrease your administration overhead, because if you do it right the first time, you're going to spend a lot less time on denials, errors, frustration with families, and just inaccurate estimation of costs really is hard on your practice. So see, this is going to be just a section of all the terminology, all the words, acronyms that are more commonly seen by midwives and the claim processing system. So a health maintenance organization, you've heard me in other courses say HMO, PPO. I rarely talk about POS, but an HMO and a PPO are most insurance plans. HMO means health maintenance organization. We're talking about this insurance plan only accepts coverage for in-network providers, people that they have done specific contracts with that are willing to accept their in-network negotiated rate if they do not have out-of-network benefits, if they have an HMO, and that is getting more and more common across the United States. WA has to do with in-network negotiated rate. I don't see this acronym very often. It's usually more the next term, the allowed amount. But it's specifically that contracted arrangement for you have a fee schedule, and then they have an in-network negotiated rate they're willing to pay you. Sometimes you can have some wiggle room, but in the beginning, starting your practice, usually you have to accept, being small, private, new to the insurance company contract, you have to accept that in-network negotiated rate. So you have to decide, do I want to be in-network, do I want to be out-of-network, and accept cash. Allowed amount is typically what you see on the assignment of benefits, the explanation of benefits. This is the amount that in-network, this is what the insurance company is willing to reimburse you for that code, that service procedure. And then usually if it's an in-network rate, the family, it's a written off. So if your fee schedule is $1,000 for a code, the insurance company says they'll pay you $500. They'll either have it go towards the patient's deductible, they'll have it go towards the co-insurance, or if the patient had met their max out-of-pocket expenses for the year, then that $500 would be paid by the insurance company. The other $500 from your fee schedule, whatever code that is, has to be written off because you're in network, you've agreed to their discounted rate. If you're out of network, even if there's an allowed amount by that insurance company, the family can be billed for the remaining amount. So point of service plan, I don't see those as often. It's kind of a hybrid between an HMO and a PPO. They have a better rate of coverage within network providers. You can go out of network, but usually the coverage isn't very good and it's a much higher deductible level. So it's that hybrid. I've seen a few plans that way, but most of them, from what I've seen in the Midwest, is 70-75% are HMOs, and then maybe 5% are POS, and then 15-20% are those PPOs. So PPO has to do with preferred provider organization. This usually costs more by the families each month with their monthly in premium cost. It usually costs the employer more because it's giving families the choice of choosing somebody in network or at a network. There's no restrictions of a care provider unless it's a non-covered service with their insurance plan, but it's not so much based on the provider. The other big difference with a PPO and an HMO, PPO usually has two-tiered. They'll have an in-network coverage of detailed benefits and an out-of-network coverage of benefits. Sometimes the deductible will be separate. Sometimes the deductible, whether somebody is in-network or out-of-network, will meet that level together. So you just have to learn the verification of benefits, the questions to ask to learn what their details of coverage looks like with a PPO. So the big thing is HMO only can see in-network providers, no coverage for out-of-network. POS has in-network a better coverage level, but you have the option of going outside your network. You just have to pay more for it. And then a PPO has in-network and out-of-network benefits, and sometimes they're similar, but typically if you're going to see somebody out of their network, it'll be a little bit more coverage responsibility for the family. Covered services. So the simple thing between covered services and non-covered services is this insurance plan, every private payer makes the decision what their plan will cover and what their plan won't cover. So the biggest thing with being midwives is asking, does this insurance plan cover home births, out of hospital births? Do they cover birth centers? And clarifying when you say birth center, make sure your state regulations and what they define as a birth center is also what you define, because I've gotten so many families and midwives frustrated because they'll call and do a verification of benefits and they'll say, I have a birth center, and the insurance plan will say it's covered, but they're talking about an inpatient birth center, not an outpatient. So that's why it's really important to know those place of service codes. So then you're not getting any of those subjective terminology, what a midwife interprets as a birth center and that representative on the phone may interpret as different. So covered service is just, what does this plan, those list of CPT codes, the list of place of service codes, the list of the fee revenue codes, what do they cover with being a certified professional midwife, a certified nurse midwife? What does this plan cover? Non-covered services has to do with anything outside of this plan. So a lot of it I see is the home birth setting. There's quite a few insurance companies, Medicaid, Blue Cross Blue Shield, Aetna, United Healthcare isn't too bad, but there's some local payers that do not cover out of hospital birth. So those are really important discussions to have with the insurance plan, have with the families, so that they know what is the difference between a covered and a non-covered service. If it's not covered by their insurance plan, it's an entire upfront cost by the patient, and it wouldn't count towards their deductible or any part of their coverage responsibility. So deductibles, that has to do with what the family will pay during the insurance calendar year before the insurance company starts paying. There are exceptions to that with the Affordable Care Act. There's a lot of preventative codes that are paid 100% even if the deductible isn't met. So the examples I like to give with midwifery services is OB, prenatal maternity services, birth as long as it's a covered service and out of hospital, newborn care, breastfeeding support, smoking cessation, annual exams, so those GYN pap smears, those things are traditionally covered as long as it's not a grandfathered in plan before the deductible. So a deductible could be a $500, it could be $1,000, it could be $5,000. They could have an individual deductible, they could have a family deductible. And so the big difference, if they have a family deductible, everybody would contribute. So their children, their dependents, their spouse would all, whatever services that each one had needed for medical expenses would group towards it. If they have an individual deductible, each person has an amount they have to meet before the insurance company starts to pay. And then once you hit the deductible, it traditionally switches over into a co-insurance. Sometimes that'll automatically hit the out-of-pocket max, but usually once the deductible is hit, it switches over to part the insurance company pays and part the patient has to pay. It could be a 90-10, it could be an 80-20, it could be 70-30. I've even seen 60-40, and that ratio has to do with once you hit the deductible. So 70-30 means insurance company will pay 70% of the allowed amount and the patient would have to pay 30% of the allowed amount. Once you hit an out-of-pocket max, that is the most for a calendar insurance year that the family would have to pay for covered services. Once you hit that level, whether it's $2,000, $5,000, $10,000, then the insurance company pays 100% for the allowed amount services. And then once you hit your calendar insurance year, it'll start back over again. Co-payments, which some insurance plans have, some insurance plans don't have, it has to do with office visits. Usually it'll be a primary care copay and then a specialty copay. These copays are more office problem visits, GYN services. Even though nurse midwives are primary care providers, I have not found an insurance plan that recognizes a nurse midwife as a primary care. We're recognized as specialists, obstetrician, gynecological specialty. So even if a family's insurance plan has a $25 copay for a primary care visit and a $50 copay for a specialist, our charges as midwives will always be that higher, that specialist copay. So just making families aware of that. So the next section has to do with clean claims. So when you're doing billing processing, it's a claim that your insurance company is receiving that's free from errors, mistakes, it's processed in a timely manner. You don't have to do a denial process, an appeal process. Everything is on there appropriately. You have your diagnosis code, you have the correct documentation, you have the correct place of service. Everything looks perfect. That is a clean claim, and that's what we want to have the first time around. The more times you have to resubmit a claim, the more times you have to fix things, the more overhead cost and the less likely you're going to get paid. Even if the insurance says it's a covered service, but it goes towards the deductible, the longer it takes to process a claim, the more likely that outstanding balance will not be paid by your patient. So it's really important to have timely processing of claims and get your finances in order with your practice. Explanation of benefits has to do with after the insurance processes the claim, they do a breakdown for the practice and for the patient to show what was covered, what wasn't covered, what was the allowed amount, what was denied, what's the patient responsibility, and it really just does a breakdown of what you should get paid as a patient, as a practice, and what is the insurance responsibility and the patient's responsibility. An assignment of benefits has to do directly with the insurance payment going directly to the practice, the midwife doing the services, and that's after a successful claim has processed. Electronic remittance advice is just explaining that that claim, the explanation of benefits, is being sent to you electronically as a digital format, which is becoming more and more common. If you got a claim that's denied, they'll go in details why, and you can resubmit the claim with the updated, corrected codes, modifiers, resubmitting with additional documentation to defend why you sent that claim. So to go over a summary of billing terminology, I know there's a lot we talked about in this section, but I really want to stress it is a new language. It's like learning, I joke with Spanish and Rosetta Stone. You just have to talk about it more often. You have to you have to be immersed in it. You have to make flashcards. You have to talk the talk. It really makes a difference with your staff and training them, the receptionist, your billing, talking to the insurance representatives on the phone, getting prior authorizations, getting verification of benefits, having those conversations with that first consultation, and the families to talk about their insurance plans, the estimation of costs, advocating for them so that they can understand this isn't just a one-time thing. They'll use their health insurance card. It is their life that they're going to have health insurance and need to understand what is a deductible, what's a copay, what's a covered service, and what's a not covered service. So insurance claims and just insurance in general is a very complicated process, but learning these terms, learning these definitions, learning how to advocate for your practice and yourself will just help you to be a very successful business and to help you have unnecessary costs for your own health care. So please, please, please take some time, re-watch all these videos about medical terminology, about billing, because it really will affect how successful your practice is short-term and long-term. So I always reinforce, if something's really overwhelming and complicated, how do you eat an elephant? You do it one bite at a time. Even me making all these courses, I stress to people, you do section by section, you learn it really well, you do your research, you immerse yourself, you really acclimate your financial policies and procedures, and you'll get a very good, successful midwifery practice.